recording today's webinar, and we will make it available for viewing on our YouTube page, usually within a couple of days, so you can visit, so you can rewatch it or share it with your colleagues, family members, friends, whoever you think this might be applicable to. So let's get started. For those of you that don't know who NeedyMeds is, we are a national nonprofit, and I always throw a screenshot of our homepage up there because really our website is the face of an organization. Anyway, our mission is to educate and empower people seeking affordable health care. And we define education in two ways. One, certainly by educating people about NeedyMeds and the resources we offer. And the second way is by letting them know about other invaluable resources and timely healthcare topics, which is why we are so pleased to have our guest here today with us. It is my pleasure to introduce Lucilia Prates-Ramos, our statewide director with the Massachusetts Senior Medicare Patrol program, or the SMP program. Lucilia is going to discuss steps to protect yourself and those you love from healthcare errors, fraud, and abuse. Lucilia has been the statewide director of the Massachusetts Senior Medicare Patrol since 2002 and has served on multiple boards and advisory councils for foundations and a number of nonprofit organizations. In 2007, Lucilia was appointed to the Massachusetts Department of Public Health Council by Governor Deval Patrick. That was in 2013, she was reappointed for another 6-year term by our current governor, Charlie Baker. So today, Lucilia is going to spend some time highlighting how being fully present for our healthcare encounters can help protect us and those we love from becoming victims of healthcare errors, fraud, and abuse, which not only costs billions of dollars, but it can also have devastating health-related outcomes. So without further ado, I'm going to go ahead and pass the mic and the screen to Lucilia. So bear with us while we make that transition. And Lucilia, you should be able to grab the screen now and take it away. Thanks, everybody.
Okay. Is my screen up?
That looks perfect, and you're just going to want to go to the slideshow and go to the slideshow tab, and then that should make it a bit bigger for us. Yeah, and looks like we're good to go. Take it away, Lucilia. Thanks, everybody.
Okay, so good morning, everybody, and well, good afternoon, everybody. It's noon, depending on what part of the country you're participating on the call from. So I'm going to speak to you about being an engaged healthcare consumer and protecting yourselves from and those that you love from becoming victims of healthcare errors, fraud, and abuse. The Senior Medicare Patrol program is a federal program. There are 54 programs, one in each state and one in Guam, Puerto Rico, Washington, D.C., and the U.S. Virgin Islands. We are funded by the Department of Health and Human Services, the Administration for Community Living, otherwise known as the Administration on Aging. And our mission is to empower and assist Medicare beneficiaries, their family members, caregivers, to prevent, detect, and report healthcare errors, fraud, and abuse. And we do this through outreach and education and counseling of individuals. In Massachusetts, I have tweaked our mission to really focus in on the fact that we need to be fully engaged and very present in our healthcare. So we reach and educate Medicare and Medicaid beneficiaries, family members, and caregivers and professionals about the importance of being or becoming engaged healthcare consumers and promoting that among the people that we serve. Because unless we are otherwise very present and aware of what's happening to us and what kind of an encounter we're going to have with the healthcare system, we're not going to be in the know as to what is my visit for? What kind of exam am I having? What tests are being done? And are the accurate tests, in fact, being done when I get to the lab? And I'll share some examples with you that will highlight that a little later. So presently, in Massachusetts, we can serve 10 different language groups. We have the internal capacity to do this with our volunteers. This is a volunteer-run program, I failed to point out earlier. But in accordance with the Office of Civil Rights, all federally funded programs must provide language access to those seeking services and those that we serve. So people should not hesitate to ask for linguistic capacity or translators and interpreters when dealing with the healthcare system. We work with an advisory council in Massachusetts, and that should also be done throughout with other programs in other states. So I put that there. I know it's Massachusetts specific, but I wanted to point that out because if you're looking to serve on a council, you might want to reach out to your SMP program. We encourage input because our motto, and this is our national motto, is we work in partnership with lots of programs, and we work in partnerships with the AAA. AAA is not the AAA we call for our car. They're the aging service. They're the Area Agency on Aging, otherwise known as the Aging Service Access Points. We work very collaboratively with AARP. We work with councils on aging and senior centers and other aging service providers across the spectrum of care. Governmental and non-governmental and other mainstream entities, disability resource centers, triads. I don't know if any of you are familiar with triads. The triads are essentially a triangle, because that's what triad means. But at every angle, there's a group that's working to improve the lives of elders and to protect them against being scammed. So there's law enforcement at one angle, and that is from the sheriff's office, DA's office, local police, and at the other angle, we have elders. And at the other angle, there are aging service providers, and that is representation from the Councils on Aging, AARP, AAAs, or the ASAPs, and other community-based organizations, as well as faith-based organizations. We work very closely with mainstream entities as well as community-based and faith-based and other grassroots organizations, so that we can really reach the truly needy population, because our program is mandated to reach those that are hard to reach, vulnerable, and otherwise not being served, the homebound, so that they understand that when they get their medical bills in the mail or their Medicare summary notice and explanation of benefits, that they should be looking at them and really verifying whether or not they receive the service. Because according to our federal government, there are billions of dollars that are lost each year due to waste, fraud, and abuse. And so that number is anywhere from 60 to 90. That's the number we use, and that's a conservative number. And in fact, a couple of years ago, we had a statewide conference here in Massachusetts, and we had the director from the Centers for Program Integrity at the Centers for Medicare and Medicaid Services come in. He was, in fact, our keynote speaker, and he raised the awareness of everybody that was present that, yes, it's billions of dollars, but if we put waste, fraud, abuse all together, overusage, the number mushrooms to over $200 billion a year. That's a lot of money that's wasted in our healthcare system. And I think we all have a role in really being the eyes and ears and reporting what is not working well in our healthcare system. What is fraud? Fraud, we know, is intentional. One knowingly and willfully lies in order to get paid for services that were not provided. Fraud is always intentional deception and intentional misrepresentation. We see some of that, but we see a lot of errors that need to be identified, and I will share some examples with you on that. What are errors and abuse? Errors and abuse are those that are typically unintentional incidents and practices or procedures on the part of providers that are not consistent with sound medical, business, or physical practices. And these procedures may result in receiving payment for services that fail to meet professionally recognized standards of care and are medically unnecessary, or incur unnecessary costs, and can also be harmful. So we need to be very vigilant about this. I'm going to share examples with you, and I'm going to share examples of where we see a lot of this play itself out. And I don't mean to demonize anybody, but these are actual cases that we are actually working on day to day. So I'll give you a nursing home example, and this actually happened to my mother personally. So I speak to you as the director of the program, but also as a daughter, a caretaker, a healthcare proxy. So my mother was in the hospital. She was hospitalized, and she had dementia, so she was hospitalized because she took a fall. She ended up in the hospital for over a week. She had hit her head and had a large hematoma on her head and was unable to walk. And so she ends up in the hospital, and then she goes into rehab. And she went into rehab, and the rehab was in a nursing home facility that also offered the long-term care services if we chose to admit my mother to a nursing home, which we were not ready to do as a family, although we were being encouraged to do so. So she goes into the rehab. She's in rehab, and I was there very present every day. And like a dog on a bone, my mother goes into the nursing home. She's the rehab section of the nursing home. And we had a family meeting. She was going to be moved. She was going to be discharged, but down the road, they didn't see that in the very near future. And then they moved her into a private room. And so red flags went up in my devious mind, and I thought, I'm sure we're going to get a notice that she's going to be discharged in the very near future. And I alluded to this to my siblings, and I said, we really need to figure out what we're going to do with Mom, because she couldn't go back to the assisted living facility she had been in because of her health. And sure enough, a few days later, within the week, we were notified that she was going to be discharged. And she was going to be discharged, and the cost of her stay thereafter upon discharge was going to be $500 and some odd a day. And I thought, well, that's interesting because I don't think she's ready for discharge. So, being where I am, I decided I'm going to appeal this. So I appealed her discharge, and her appeal was granted. But in retrospect, and looking back at this, and why I put this here as an example, is I felt that was a very subtle abuse and on the part of the nursing home, and I hear about this from a lot of places. And so I put that on there because I don't know if there's people from nursing homes working on here, but on this call, but I encourage people who work with people who are in nursing homes or who have consumers that they represent who are in this limbo status of being admitted to a rehab facility / nursing home and possibly going into a nursing home facility, that you really educate people about what their rights are. Rights to appeal, because we weren't given any of that information. I happen to know it because this is what I do day in and day out. So it was very interesting, and this happens across the board and across all states. It's not just specific to Massachusetts or to my mom. Lab tests, billing for tests that are not performed, this happens all of the time. I see this daily. Overusage, people talk to us about overusage. In fact, I'm going to a meeting tomorrow about overusage. Somebody who resides in another state but receives care in our state, and I've been pulled into that meeting because she feels like she was receiving medical attention that she really did not need or want. Unbundling of tests, ordering the wrong tests. We have a gentleman, an elderly gentleman, who was went to the lab and had a prenatal panel done, and Medicare refused to pay it, of course, and then he was sent the bill, and we had to intervene in order to clean that up for him because he couldn't navigate his way through that. Just simple but actually errors that have no business happening. People really need to be paying attention to what it is that they're doing, and sometimes that falls through the cracks. And so I'm going to go on to durable medical equipment. I think you're getting, if you haven't already received, an article about Rita. Rita is a consumer who was living in elderly housing and came to us through her resident service coordinators. I don't know if there's any resident service coordinators on the call, but you're all pivotal to referring clients to us so that we can help them navigate their way. Rita got a wheelchair that was not right for her. She had an old wheelchair, which she's actually sitting in. If you see the duct tape on there, the red duct tape. This is her old wheelchair, and her battery had gone. That wheelchair was about 10 years old. She got a prescription for a new wheelchair. She called a durable medical equipment company that had been soliciting consumers that resided in her building. She got a wheelchair within a week. The wheelchair was delivered to Rita. She was never weighed. She was never measured. They brought a wheelchair to her, an electrical wheelchair that just did not navigate the apartment well because of the footrest protruded out. Rita hurt herself, fell out of the wheelchair. She wasn't comfortable with the wheelchair. She kept calling them, and so did the resident service coordinator, calling the durable medical equipment company to come in. Get this wheelchair and bring her another wheelchair. She wasn't happy with this. And they were not going to do anything about this. We got involved, I'm going to say a year or so later, and after she had this wheelchair, which she was not using, by the way. And so when we got involved and we referred it over to the Medicare contractor, the durable medical equipment company was informed that they had to come and pick up the wheelchair and refund the money to Medicare for the wheelchair that Rita had been complaining about. And as the article points out, the money was refunded to the Medicare fund. There are a lot of Ritas out there, with wheelchairs, with leg braces, with knee braces. There's a lot of marketing that happens in elderly housing, and door knocking campaigns that go on that we hear about throughout the country, where people come. If the individual doesn't happen to speak their language, they get somebody from that particular language group to come and market this, whatever it is that they're marketing, whether it be carpal tunnel braces, wrist braces, or leg braces or back braces. They market this there's a multi-pronged marketing campaign that goes on out there, whether it's the door knocking or telephone calling or television, and people get stuck in this whirlwind of confusion, and they end up with all of these products at their home, and none of it fits. They don't even know how to put it on oftentimes, and then what happens is that we get involved. And, you know, oftentimes we're able to help. Sometimes there's nothing that can be done. You know, Medicare has paid out the money, and that, you know, we refer it on to the Office of the Inspector General. And then they go chasing the money, but that takes a long time. So we see also a lot of fraud in home health services, you know, performing skilled nursing and home health aid services in the single visit, and then falsely documenting records and billing for 2 visits having taken place, billing for skilled nursing or therapy services when really, you know, other services were provided, such as housekeeping or homemaker, home chore, custodial services, billing for services provided to beneficiaries who do not meet a homebound definition, and Medicare is very clear about that. And so it's very important that people understand what services they're eligible for and what is really being provided. And we're dealing with oftentimes a population that really needs an advocate or a relative that's very present, and sometimes that's not possible. Billing for skilled nursing and unskilled nursing care that was provided by a home health care worker, and that is not acceptable as well. So how do we do this work? Well, we go out and we educate people, and we give them stories. We tell them a lot of stories because I think it's all in the story. And we encourage people to use a personal health care journal. And I think the most important recommendations that we can make to people are to keep a list of all of their medications, to keep a list of all their appointments, who they saw, prepare for that medical appointment, carry their journals when they're traveling, keep a chronological account of what happens to them in within their medical encounters. Who did I see? What did I see them for? Think about questions you might have for the doctor. And when I'm dealing with older individuals, I always say to them, you know what? Write it down. Write down what you want to ask, and then write down the answer to that question, because I know that I forget. Sometimes I feel a pain somewhere, and I'm like, I have to tell my doctor this is a little unusual. This is different. And if I don't write it down, when I go in for my annual visit, I don't remember what I thought I wanted to tell the doctor, you know, a couple months ago. I say to people all the time to please compare their SMP personal health care journals and the entries that they make to their explanation of benefits, the Medicare summary notices, and health care statements and bills that they may get. If people do not get these documents, they should be asking for them. We should all be receiving explanation of benefits in the mail, and Medicare beneficiaries who are on original Medicare ought to be getting their Medicare summary notices as well. So for those of you who are not familiar with Medicare, I'm going to just give you a very quick overview. And you have to bear with my graphics here, but, you know, Medicare is a puzzle. And you know, I don't know if people have heard of Medicare A, B, C, and D, but there are all of these parts to Medicare. Medicare A is the part of Medicare that we've paid throughout our working life. You know, typically, one would have, to be eligible for Medicare, you'd have 40 qualifying quarters. And there are exceptions to that rule. 40 qualifying quarters is the equivalent of 10 years of work. And it doesn't have to be 10 full-time years. So I'm not going to get into that because that gets very complicated. But you have to have had worked and earned a certain amount of money in any given year to have the qualifying quarters for that particular year. And once you've accumulated 40 qualifying quarters, you're eligible for Medicare. So Medicare A, Part A, is what we get when we turn 65, or if one becomes disabled, or if one is younger and disabled. They can also have this. You could have a child on Medicare. So inpatient, and the child wouldn't have 40 qualifying quarters, but the parent would. So it gets complicated, and I'm not going to go into that. It's very complex. So Medicare A pays for inpatient admissions, home health care. When we leave the hospital and we come home with visiting nurse, home health care services, that's who's paying for that, Part A, because one can look at that as almost an extension of their admission. Hospice, okay, and a skilled nursing facility. Skilled nursing facility, if an individual, like my mother, when I pointed out my mother's example, she was admitted to the hospital, she was in the hospital, and then she went to a skilled nursing facility for rehabilitation. One needs to be very careful with this, especially this is more prevalent now than ever before, but if one does not meet a 72-hour rule, 3 midnight rule, under Part A, being admitted to the hospital and is sent to a skilled nursing facility, they need to really be very certain that Medicare is going to pay for that skilled nursing facility, because if one was not admitted, an inpatient admission to the hospital for the 72 hours, they may not have the skilled nursing facility paid for. And so that needs to be, people need to really ask that question and understand what their admission status was, so they don't end up with a bill for $500 a day after leaving the hospital and going to a skilled nursing facility. We've come across a lot of cases like that. And that's just the rule, that's how it works, but people really need to understand what the benefits are and how they work. So Part B works in conjunction with A, right? It's outpatient. It pays for outpatient care and consults, while beneficiary is an inpatient. And there's what's called the Medicare Renew book, and the Medicare Renew 2017 book is out now, and it explains in the Part B chart what services are paid for. Now, Medicare only pays 80%. So if people have a Medicare A and B, they need to buy a supplemental plan, which we refer to in Massachusetts as a Medigap. It's a Medigap, so Medigap/supplemental plan. That will pay the 20%, so that 100% is paid for. So I encourage people who have family members or who may themselves be enrolling in Medicare to see a SHIP counselor, because SHIP counselors can help individuals understand what parts of the puzzle they need working for them. Because one could be retiring at 65, have Medicare A, but also be working and have insurance through their employer that will work in conjunction with Part A. But it's really important to understand how all that works, because you need to have credible coverage. So Part C is an animal of its own. Those are the PPOs and the HMOs. They're the Medicare Advantage plans, and they typically include the prescription coverage. If you have A and B in a supplemental plan, you also need a Part D to pay for prescriptions. So Part B gets paid for through the Social Security check that people get on a monthly basis. That's taken right out of the Social Security check typically. And the Medigap plan that one purchases, they pay for that on a monthly basis. And the prescription drug coverage is the same. They also pay for that on a monthly basis. And one can choose to have that withdrawn from their Social Security check, but we recommend that you don't do that. And you can also have it withdrawn from your bank account, and that's a choice that you can make. But I would encourage everybody who has a relative or who has a consumer that they're working with who is a Medicare beneficiary to seek out the counseling services of a SHIP counselor. So here are some important reminders for people. I encourage individuals, or we encourage individuals across the country, not to carry their cards except when needed. And that's when they're going to the doctors and they visit a hospital or a clinic, they have an appointment, or they're going to the pharmacy. Okay, one should protect their Medicare card or their Medicaid card. Please forgive the Mass Health here. And other insurance cards, Mass Health is only for Massachusetts, that's what we call Medicaid, and other insurance cards as they protect their Social Security card and their number or credit cards. Now, I should say to you that there's, at this point, that there is a Social Security number removal initiative that's going to be implemented beginning April 2018 next year, and it will conclude by the end of 2019. And that is that the Medicare will be removing people's Social Security numbers as the identifier for their Medicare number. Because right now, the Social Security number of the individual or the spouse, one could get Medicare through their spouse or their parent, the Social Security numbers are going to be removed as the identifier, and they will be given a new number, the same number of digits, but a new number. So that's going to happen. It'll start, as I said, on April of 2018. It'll conclude by December 2019. We are already seeing scams pertaining to this happening. So I'm sure people are going to be called. Medicare is going to, pretending to be Medicare and telling individuals that they need to confirm the Social Security number, et cetera, et cetera, et cetera. And people will fall for it. Some people will fall for it and give out their number, and we're going to see an uptick, I'm sure, of identity theft. People need to be very careful. So, why? So Medicare has actually, in 2008, Medicare took a stance on health quality and decided that they were not going to pay for certain conditions. And these are some of the conditions that they will not be paying for: foreign bodies, foreign objects being left inside an individual when they do surgery, transfusion of the wrong type of blood, severe pressure ulcers, falls and trauma that may happen in the hospital, fractures, joint dislocations. They're all there for you. I'm not going to bore you by reading them. There's also a press release that's dated 2008 that explains this very concisely, and I sent that to Carla, and she'll be sending that out to individuals just so that you're in the know. And this is all of, again, another reason why people really need to be engaged and need to understand what they're going into the hospital with and what is my diagnosis upon admission, And what's my diagnosis or diagnoses upon discharge? Did something happen to me while in the hospital? All right? Why? Because Medicare will not be paying at the same rate for these conditions, nor should the consumer receive a bill from the entity. So this is all, again, another reason why it's important to keep this chronological account of what happens to us when we are admitted to the hospital and what we're going in with and coming out with. We do a lot of interagency referrals, and in Massachusetts, this is just an example. But I would encourage you to reach out to your local SMP in your state and see if there's a way that you can work with them, and that you might put an interagency referral in place. Because individuals need to really understand what's available to them and what are some of the issues that they could be facing, and who do they turn to, because oftentimes people don't know who to turn to. Important reminders for beneficiaries. I always encourage people to absolutely make sure that their prescriptions are paid by their Part D, and if they're not covered by their insurance, the consumer should explore the following options: the exception form, if a medication is not covered or included in the plan's formulary, that they ask the prescribing doctor to submit an exception form to the insurance company, and oftentimes those are granted. Limited income subsidy is another benefit that they could apply for. The state prescription assistance program. I also encourage people to contact the schools of pharmacy and health sciences. They often have a pharmacy outreach program. I know that here in Massachusetts we have a wonderful program that I often refer people to. And you guys have NeedyMeds, which connects consumers to programs that assist with paying for healthcare costs and medications. So reminders again, always consult a SHIP counselor. Encourage people to consult a SHIP counselor during open enrollment, or if otherwise needed. It doesn't just have to be around open enrollment. At any question, they're there and they can answer those questions. Always to check for restrictions on their Part D plans, and to understand their Part B benefits. Always make sure that medication, in fact, belongs to the individual or the patient or the person it's intended for. Very important. I know of people who, and this has happened to me, that has picked up medication at the drugstore and someone else's was attached to the same bag. Always count the pills in the bottles. Very important, because if the pills are not counted and later on in the month one realizes that, gee, I didn't get the right number of pills, it may be too late to have those pills given to you by the drugstore. In fact, if it's a controlled substance, that will not happen. So you're also going to receive a gaining access form, and I put that in the packet because, again, if you decide to work with your local SMP or your state SMP, this might be a good tool to replicate or to create on your own, and identify these resources to give to the people that you work with, because often times people don't know where to turn to, and it's nice to have a compass of sorts. So I always say to people, start by calling us. We'll guide you, and I pride myself in that because all of our counselors who are absolutely dedicated volunteers, I say to them, one thing, we cannot leave people out in the lurch. So let's, help them navigate their way through this. If we're not the entity, we'll refer them to the appropriate entity, and they should feel free to call us back if they need to. So steps to address healthcare errors, fraud, and abuse. We I put this here for the purpose of this webinar, SMP Resource Center. They have an SMP locator on this website, www.smpresource.org, that you can look up your own state and contact your own SMP. Medicare, 1-800-Medicare is a good number to call if you have questions around healthcare errors, fraud, and abuse. The Inspector General's hotline, which is here, 1-800-HHS-TIPS or 1-800-447-8477. And then Medicaid fraud, it's specific to each state. You can just Google this. In Massachusetts, I know it's the Office of the Attorney General. We work closely with them. But in other states, it may be the Division of Insurance. It may be others. So you can look that up. So some reminders that I have are to all Medicare, Medicaid beneficiaries, family members, caregivers, all healthcare consumers. In fact, we always need to be reviewing our bills, our receipts, keeping a record, keeping a journal, comparing things to our explanation of benefits, our Medicare summary notices. And if we didn't receive these documents, I said this earlier and I can't repeat this enough, if we don't receive these documents, we need to inquire as to why not and request them because we are entitled to them. Word of caution is that beneficiaries should be encouraged not to pay their bills until they have compared them against their journal entries, their Medicare summary notices, explanation of benefits, and other statements, and understand that the bill really belongs to them. I'm going to share an example here with you about a gentleman that I've been working with for, it'll be 2 years in August. This gentleman's wife reached out to me because her husband received a Medicare summary notice and a bill from a hospital in the Boston area for care that was delivered to him, presumably, but he has never stepped foot in that entity. And when we talked, and she had tried to call this hospital and try to get this ameliorated. Well, it never was fixed to date. Okay, so the bill is still. He has personally not paid anything because they realized the error that they made was that when they put his name into the put the actual patient's name into the computer, they have access to a CMS database with numbers. And so they got this gentleman's name, and who is from abroad, he's an international patient, and his name is the same name as somebody who resides here in Massachusetts. And they assigned the Medicare number to this individual, and it got charged against the patient, the consumer, who never stepped foot into the hospital. So $13,000 later, this international patient should have paid. It was charged to Medicare with the copay because they couldn't figure out what his supplemental insurance was. So he's got the 20% that he needs to pay. So we're still trying to get documentation to go to Medicare so that Medicare recognizes that, this was not the individual, and that Medicare is refunded its money by the institution. And that Mr. X, who never stepped foot into this institution, gets that wiped off his Medicare record. Because if he ever would have needed that particular surgery, that may be questionable. So we want to make sure that the slate is wiped clean. And so we're working very closely with the entity and with the Medicare contractor to get that done. So it's important for people to understand that Medicare will not call or visit or solicit, sell products or plans or any other item. Please pass that word out, make that known to individuals that Medicare does not reach out to individuals to sell products or solicit. And they are about to receive, I think, lots of calls from people pretending to be Medicare, given the Social Security number removal initiative that is going to be launched within the beginning of next year in April. It's important for people to understand that if something does not feel or sound right, it's probably not right. A gut test is a good test. I'm a firm believer in that. And to contact the local SMP program by visiting, again, the resource, www.SMP resource. Mass residents, feel free to call us, those of you who are on the call who are from Massachusetts. And it's also important for us to realize that it's our responsibility. We all hold the key to preventing healthcare errors, fraud, and abuse. And it really is by becoming fully engaged consumers and encouraging friends and our loved ones to do the same. And now I'll take any questions from you that you might have.
Fantastic, Lucilia. Thank you so much. If you want to go ahead and give the screen back to me when you get a chance. And as Lucilia said, feel free to go ahead and shoot us your questions. And you can do that by typing them into the questions section of your GoToWebinar control panel, which should remain on your desktop. And we actually just have a couple of questions already coming in. And another reminder, if you think of something after the webinar, let's see, everybody, you guys should all see my screen. Do you see my screen, Lucilia, now?
Yeah.
Great. So as I was saying, just a reminder as far as the questions go, if you're like me and you have no questions now and then 10 minutes later, 3 pop into your head, we're going to, of course, provide you with our contact information. Lucilia already had that up. I'll have that up on my last slide, and I will also send you a copy of our PowerPoint presentations after our presentation, which will also have our contact information. So a couple of quick questions coming in, Lucilia. Here's actually 2 that we can sort of group together. How does the SMP program handle complaints, and how long does it typically take to resolve a complaint?
So we get complaints from consumers, and we have an initial intake process, or they come in through a referral, and we personally speak to the consumer. One of our case managers speaks to the consumer, and we get all of their information down, and we have a multi-member team here of counselors, and we have weekly meetings to discuss our cases. So we take all of this data from the individual who's calling us. We get a release of information signed by them. We enter this data into, I'm repeating myself, a national database. And we then refer the case after we've collected all of the data, done all of the research. We try to facilitate the interaction between the individual and the entity to see if it can be taken care of. And if it can be addressed, oftentimes the consumer has already tried to do this on their own and has had no success. So we may call and say, we're calling from the Senior Medicare Patrol program in Massachusetts, and here's the issue. And the issue is resolved. We get it in writing, we document it, and we close the case. If that does not happen, then we refer to the Medicare contractor. The Medicare contractor then intervenes and looks, researches, investigates what's going on with the particular case. And then the outcomes are reported to us, and we put that into a national database. Now, our national database is kept because the Office of the Inspector General is also looking for trends. Is Hospital A making this mistake on a regular basis? Is this particular nursing home doing this on a regular basis? Is this durable medical equipment doing this on a regular basis? Are these just simple errors, or does this look a little abusive? So they're looking at those trends. Typically, it takes, we can resolve an issue sometimes in a week. Sometimes it takes 2 years, like the one I just pointed out to you. Is a gentleman who is still waiting for documentation because we can't close anything until we have documentation that, in fact, it has been resolved. These are the action steps that took place, and this was the money that was returned to Medicare or to the individual. Does that answer the question?
Very thoroughly, thank you. And one of the things that I'm sure our listeners like myself find very comforting is not only are you a great and reliable resource to turn to, but as you have mentioned to me previously and mentioned during this webinar, and I really want to stress, is that the SMP will take your complaint or your issue and they will not let it go until it is resolved. It will not be forgotten.
Right.
They will not say it's too difficult, it's too complicated, we don't know where to go. If they don't know,
right.
they'll tell you, and they will do their best, and you can be assured that they will not let it go, which I find very comforting, as I hope some of our listeners will as well. Lucilia, another question coming in is whether or not there are any costs associated with your service. And I'm not sure if you actually addressed that. Okay.
I said we were funded by the HHS. There is no cost. There is no cost associated with the work that we do.
Great.
And sometimes we end up referring cases to the, to the Attorney General's office for a complaint, that is beyond our scope, or we send it to the Quality Improvement Organization, which is Levanta, which is an organization that all consumers really ought to know about. For Medicare beneficiaries, the Levanta is an entity that really is in charge of making sure that the care that they're getting is quality care. So if there's any question around the care that a relative of yours is receiving, or you yourself who might be a Medicare beneficiary, that's the entity to be calling. And then, if I feel that it needs to be, if this is a serious reportable event, and it really should go to the Department of Public Health, because the Department of Public Health needs to hear about this particular incident or this particular entity, then it goes to the Department of Public Health. So oftentimes we find ourselves referring it to more than one place.
Right. Well, that's also really helpful because I know myself as a novice, I wouldn't know where to begin. And the fact that you're not putting on the onus on the patient or the Medicare recipient to figure out, trying to navigate who the appropriate entity is also extremely valuable.
Well, it's very difficult, especially if you're in crisis mode.
Sure.
If you're in crisis mode and something terrible has happened, you don't know where to turn.
And probably many of us have been there. And here's one other question for you, and then all other questions, if they're coming in, remember we'll follow up with you via email. And as I said, you'll also get a follow-up email from me. But one other question is, if somebody were interested in requesting a presentation or training for the consumers they serve, how do they go about that, Lucilia, and is there a charge for that as well?
No, there's no charge, and we are, all SMPs are more than happy to go and do a presentation.
Great.
So, for Massachusetts folks, feel free to call us. Maybe you can include my contact information
in the email.
Somewhere.
I will. Let me just jot that down. Sure, go ahead, Lucilia.
And then if for those of you who are out of state, you should feel free to, again, go to www.SMP Resource, locate your local SMP, and ask for somebody to come out and do a presentation.
Great.
I'm sure people will be more than glad to do that. And if you want to volunteer, for the SMP program, also contact your local SMP.
Great. That's really helpful. And
we're always looking for volunteers.
Those couple of those points, or the last 3 points actually we just addressed, are a great transition for me to just bring a couple of resources to everybody's attention from NeedyMeds. Much like the SMP, although it's a completely different entity with a different goal, we also are an organization that not only do we not require any fees for any of the services that we provide you, whether it's help getting you connected with the prescription assistance program, a diagnosis-based assistance program, a coupon or a rebate, or a drug discount card. All of the resources that we at NeedyMeds provide are and always will be free of charge to our users. And you're also anonymous if you reach out to NeedyMeds. And the reason you would reach out to NeedyMeds is because you need some help affording some of your expenses for healthcare, certainly including but not limited to medications. That's why you would reach out to NeedyMeds. You can give us a call or an 800 number, which is on the top of our website, www.needymeds.org. And much like the SMP, as I said, not only would we love to have volunteers join us to spread the word across our country, but all of our resources are free. And just like the SMP as well, we would love to have the opportunity to do a presentation for your organization or business. We also pride ourselves on keeping a pretty robust calendar of healthcare topics, whether they're diagnosis related, and we've got a couple coming up within the next week. Tomorrow we have one focused on prostate cancer, one next week focused on sickle cell anemia, and the following week is our monthly overview webinar, where if you're interested, you can learn a little bit more about NeedyMeds and the resources we offer. As promised, I'm going to go ahead and leave you with the contact information to not only Massachusetts residents, but residents across your country, how you would go about contacting your local SMP program. One of the things that Lucilia asked me to mention, and I forgot until just now, she mentioned throughout the webinar Shine and Ship counselors. The NeedyMeds website does have all of the Shine and Ship locations throughout the country. So you can visit our website, which again is listed at the bottom of this PowerPoint slide, or you can give our toll-free helpline a call at that 800 number and ask for a Shine or Ship location in your area. With that, I think I'm going to go ahead and wrap up. Lucilia, thank you so much for taking time out of your busy day to spread your expertise and share your knowledge with us. It was very valuable. To everybody else that's listening, thank you again for joining us. We do hope that you stay in touch. Look forward to receiving my follow-up email, and please join us for another one of our upcoming webinars. Thanks, everybody, and have a wonderful rest of the day. Thanks, Lucilia.